Hi, my name is Elizabeth Abruzza, and I'm the clinical director of the Bellevue Trauma Recovery Center here in the greater Seattle area. And I'm here today to talk some more about emotional transformation therapy, or ETT, with one of my mentors, MJ Dennis. Hi, MJ.
Hi, Liz. I'm so glad to be here today.
Me too. Would you like to introduce yourself a little bit?
Sure. My name is MJ Dennis, and I am a licensed professional counselor and a licensed marriage and family therapist. I'm also a certified sex therapist and a certified partner trauma specialist. I practice in San Marcos, Texas. So I'm located between Austin and San Antonio. I guess I want to add
Yeah.
one of the most important things I feel I do professionally is I am an ETT trainer. I
Hmm.
am a practitioner in emotional transformation therapy, and I became a trainer a few years ago because ETT is so effective and so efficient with my clients. I felt like I really needed to train other therapists in this modality.
Like, how did you even discover ETT?
So I do have a story. Um, I used to work at Crossroads Counseling Associates up in Austin, and one of my colleagues, Rick Reynolds, he and I were on opposite sides of the wall. Our offices shared a wall. And so over the years working next to Rick, he would tell me about the trainings that he did and the new things that he learned. And he really stayed kind of cutting edge. And I remember a time when we would walk our clients out the door to our waiting room together and chat a bit. And as we brought our clients back to the office, we would chat some more. And I remember Rick saying, MJ, I learned how to do this ETT. And I've been working with a client who has been severely depressed, and we did ETT, and they aren't depressed anymore. And I remember kind of patting him on his shoulder and saying, sure, okay, Rick, because it it seemed too good to be true. And over time, he'd tell me about using ETT with somebody with anxiety and using ETT to treat OCD and using ETT to help people feel better physically in addition to feeling better emotionally. And being skeptical, needing proof, I I didn't really believe him.
Mhm.
And one day, our 8 a.m. clients canceled, and he asked me if I would like to do ETT. And of course, I jumped at that. Yes. So I went to his office, and he asked me to think about something that, when I thought about it, I felt distressing emotions. And at the time, something had happened with one of my sons, and it was fresh. And when I thought about what was going on with my boy, tears came. I was very sad, overwhelmed, scared, really, tears and boogers streaming down my face. It was very upsetting. And I remember Rick standing in front of me, holding some sticks that had color at the end of them. And he asked me to follow those sticks with my eyes and talk about what was happening with my boy. And I thought he'd lost his mind. And I what? Look at sticks with color? That's ridiculous. But I did what he said, and I talked about the situation, and I could feel my emotions changing very quickly, and it was so strange. And then I remember him asking me to sit in front of a chart, a poster that had different colors on it. And he instructed me where to look and to talk about this situation and to tell him if the colors changed. And then I really thought he had lost it because I was looking at a poster and right, how can colors change? It didn't make
Mhm.
any sense to me, but the colors expanded and they contracted and they morphed into each other. And I learned I was dissociating. And he had a way to get my brain back online, so to speak. And so he had me close my eyes and he talked me through it. And then the colors went back to how they were supposed to look. And then all of a sudden he said, "That's it. You're done. Have a nice day." And I didn't know what had happened. And I remember him going like this, "Have a nice day."
On your way.
And I went, right. I went back to my office. I think that took 23 minutes, Liz. It was
Wow.
very fast.
Mm-hmm.
And from that moment, I can think about that memory. And I've been thinking about it as we've been talking. I remember what happened. I have my memory, but it changed my emotional content. And I knew something significant had happened and I didn't understand it, but I wanted to get trained in this. I needed to figure out what had happened because if I could have that kind of emotional transformation and in such a short amount of time, I knew that this could be something that could really help my clients
Right.
and I wanted to learn. And so I signed up for my very first emotional transformation therapy class, level 1, and uh, started using ETT the very next day. Like I did the class Friday, Saturday, Sunday, and on Monday I started using it with my clients, and I haven't stopped. I use it all the time now.
I do as well. I'm just hitting on this, this it's too good to be true. That's definitely how I felt even when it was introduced to me by you, right? You and I were connected through SASH, the Society for
Mhm.
Advancement of Sexual Health, and you were my supervisor for a credential that I was working on. And I think it was maybe our second supervision. You're like, Liz, have you ever heard of ETT? Nope, no idea what you're talking about. And you explained it to me a little bit, and I kind of, similarly was like, okay, I mean, this sounds pretty amazing, and we'll see. And you had
Right.
recommended that I come down to Texas to attend level 1 training. And at the time, I was opening a practice with 2 other colleagues, and we were really looking for a trauma modality to base kind of our practice around, right? And so we were exploring a bunch of different options, EMDR, brain spotting, and you had introduced me to ETT, and I was like, let's just go and see what it's all about. Let's go and see, how real it is in our own experience. I hear things, but also, it's not very well known to other practitioners in our area, so it was very very new for us, and came down, and yeah, I mean, after day 1 of level 1, we were completely sold, and have been using it consistently and built our entire practice around it. So it's very remarkable what ETT can
Yes.
do.
I I felt the same way, and I remember that, Liz. I remember you coming and how excited I was that you and Jessica and Connie were coming to Texas to learn this modality. But I also felt confident.
Mm,
As a new ETT practitioner years ago, I knew that it worked, but I didn't fully understand the science.
right.
And because of that, I had a hard time explaining it to my clients. And initially, I only used it with established clients, people who trusted me, and they'd say, "I don't know what this ETT is, and it doesn't make any sense, but I trust you, MJ, so I'm going to try it."
Mhm.
And once my clients experienced ETT, where they would talk about a topic, they would feel emotions, and we would show different colors at different angles into their eyes. We call that precise visual stimulation. As they experience the intersection of verbal, emotional, and visual stimulation, their emotions change quickly. And from there, they started telling their friends. And the next thing I know, they'd say, "Can you ETT my spouse? Can you
Mm,
ETT my mother in law? Can you ETT my friends?" And more people started coming to me specifically to do ETT. And my schedule as a sex therapist, as a partner trauma specialist, my practice was already full.
right.
But adding in ETT and having people reach out, asking specifically to try this new way of doing psychotherapy,
Mm,
I needed people to refer to. I didn't have any more room to help people. And so I thought, I've got to train other therapists. Selfishly, I need somebody to refer to. And this is so revolutionary and, so effective. We've got to get the word out there and train other therapists around the country, around the planet, so that more and more people can experience this kind of healing.
Absolutely. And I've had a very similar experience. Our practices here are full too. And we're so full and wanting so badly to get the rest of our staff trained that we're actually going to be bringing you out to Seattle next year for level 1 and 2 training, because we also need more referral sources. We are the
Yes,
only
yes.
3 certified ETT therapists in the entire state of Washington, and we have been very busy, and it is. Once you get one, I'm getting emails saying, here's my friend, she really needs ETT. Here's this person, can you do this? And there's only so much time in a day. So we're really excited to have you up to Seattle to get the rest of our team, and then our other friends and colleagues trained in ETT. We talk about it all of the time, and people are very uh, cautiously optimistic until they experience it
Mhm.
themselves, and then they're all in.
Yes.
Could you share, MJ, a little bit more about the impact that you've seen on the therapists who have come to attend your trainings?
So teaching is so fun. I love teaching ETT. Um, Many times when therapists come to level one, it's an interesting mixture. Some people have experienced ETT and some people have heard of it, and they come in not really knowing what to expect. The people who've experienced it, we say once you experience ETT, people are drinking the Kool-Aid
Mhm.
because the change is profound yet subtle. People feel differently emotionally and in their bodies so quickly that the therapists who've experienced it know this is a kind of modality that they can replicate.
Yeah.
And there are different ways to do ETT. There, we can even do ETT remotely. And
Mhm.
because of this, they already come in excited and want to know, how do I do the different modalities? Um, the new people, it's interesting. They present like I did with Rick. They're skeptical.
Mhm.
They want me to prove to them what's happening and why it's happening and what is happening in the brain that changes how someone feels. And they want to understand, why does it happen so quickly? Because they want to be able to explain to their family, their friends, their clients what this is. Um, by the end of level one, it's so fun to see therapists, as you know, in the training classes. I teach what ETT is, the science behind it. I teach how to do the different modalities.
Mhm.
And then the therapists practice on each other.
Right?
So they get the benefit, right? That experience of feel doing the ETT, feeling the changes, and then they get the experience of practicing it and being the practitioner with some guidance and support as
Mhm.
they become comfortable with practicing this. And by the end of level one, um, therapists say something happened. I still might not understand the science
Right.
all the way yet, but I know I can go and do this with my clients, and I need to tell people about it. By the time people finish level two, and level two, they're drinking the Kool-Aid.
Mhm.
They come back and they're like, okay, what else you got? And they're ready to learn the other modalities. And then more healing happens for them as they're receiving it, more confidence as they're practicing it. Then by level three, so in level three, we start teaching protocols, ways to use ETT to treat depression and PTSD
Mhm.
and specific things that impact humans. That's where we learn, do this to treat depression, do this to treat trauma, do this to treat anxiety. Then when they come to level four, and level four is just one of my favorite classes
It was one of my
because in
favorites
level,
too.
yes, right, by then the students know each other. And that's when I really see there's such a bonding that happens as they've shared some of their own wounding or their own pain and experienced healing with these other students. When people come to level 4, I see hugs. It's
Mhm.
almost like a reunion, and people are glad to see each other. And then level 4 is about uh, treating somatic symptoms.
Yep.
So this is where we help the practitioners learn how to use ETT to help people's bodies feel better. And it's wonderful to teach that class because, as you know, Liz, people come in and whatever aches or pains or medical conditions they have, we
Mm.
do the ETT and everybody leaves feeling better.
Yes. Everyone does leave
Shocked.
feeling better. It's pretty amazing.
I
Mm.
do want to share the other classes.
Yeah.
There's a level 5 class, and that is about how to use ETT for spiritual issues. Level
Mhm.
6 is to treat addictions. We can use ETT to disrupt the addictive neural networks, the brain systems that are responsible for addictions. We can actually disrupt that. We can change how the brain acts and reacts to addictions to stop cravings, to address the underlying wounds for a person that cause them to want to numb, feel better, use a substance to, help that kind of bad medicine to help them feel better. And so in that class, people are often very skeptical, like how can we use ETT to treat addictions
Mhm.
when as of right now it's really behavioral. It's very hard, with addiction.
Takes a
There's
long
a very
time.
high rate of of relapse,
Right.
and yet we can use ETT to treat addictions. And so that class is especially important. And level 7, which is also very fun, is using
Mhm.
ETT to help couples. And as a couples therapist, this is gold because I actually can bring ETT into couples sessions and change how people feel very quickly and thereby change their patterns of interaction.
Mhm. The whole dynamic of the relationship, I imagine.
I So I worked with a couple. So it started, a lady came to see me
Mm.
and she said that her husband had been diagnosed as having a sex addiction, and that was the term she used.
Mhm.
Sometimes, people call this problematic sexual behavior or compulsive betrayal behaviors. Her husband um, had been betraying her for the duration of their 20 something year marriage. And she had recently discovered this and found out. And they went to a couples therapist, and the couples therapist told her she needed to come see me. And so she said, I'm here and I don't know why. She'd never been to counseling before.
Wow.
And right, this just her world blew up. And so I began working with her to help her heal betrayal trauma.
Mhm.
And during my time with her is when I got trained in ETT. So I'd started with her before I knew how to do ETT. Um, at some point, we started ETT, and she started changing it. Addressed the ETT, helped her triggers stop. The ETT stopped the intrusive thoughts and the ruminating that happens. She had lots of physical symptoms, and her body started feeling better, and her trauma symptoms reduced. But what didn't reduce, what was hard for her, she was so angry with him.
Yeah.
And she felt like she had to stay angry with him because if she believed if she stopped being angry, he would go back to his old ways.
Yeah.
Right. So she was fearful of not being angry, but the anger was taking a toll on her. And I met with she and her husband, and I was about to do my training in using ETT for couples.
Hmm.
Now, I knew her couples therapist, and we would collaborate. And her couples therapist was also an ETT practitioner, but had not learned how to do ETT with couples. So her couples therapist also did individual and used ETT like I did in individual therapy. So her couples therapist and I were in training together in this level 7,
Wow.
and uh, this couple volunteered to be our demo and come in and be. Yeah, I was so excited and be
Wow.
the clients. So they'd been they'd been struggling now for a few years as they were
Mhm.
working through recovery. Dr. Vasquez demonstrated how to use ETT with this couple in front of a room of there were probably 20, 30 therapists in the room. And within 15 minutes, and it really was like 15 minutes, it was so fast. The emotions that had been so stuck and ingrained for her changed. His experience, the husband's experience also changed. And they I remember them turning toward each other and her face softening and her heart softening, and the transformation was apparent and obvious. They left holding hands. I
Wow.
saw them as they walked down the hall. They stopped, they kissed, they walked out the door. Now, the couples therapist only had one more session with them
Mm.
after that because they felt like the issue that they had so struggled to resolve had resolved in that one session
That's
in
incredible.
front of all the therapists. So I see the wife on occasion when something comes up, she'll come in and she'll ask me to do ETT with her, and then I won't see her for a few months, and then she'll come back when something comes up. So
Mhm.
now it's just a maintenance. And one of the things that students ask me, Liz, is they get a little scared and they say, if I'm helping them feel better so quickly,
Mhm.
am I going to put myself out of business?
Ugh. Nope. Can answer
Right?
that.
No, and no. And so I remember when the couples therapist, she laughed and she said, well, they might be graduating and I think we're going to be ending our season. And she said, I'm so happy for them.
Mhm.
And I have a wait list. I have people waiting to get on. And so as this couple moved out, she was able to take on a new client because as people learn about ETT, they want to experience it.
Mhm.
And so it was not a bad thing. It was a celebration for the couple, and the therapist was able then to help somebody else.
What's the most common question you get for therapists who don't know what ETT is?
So people will ask me, first, like, what is ETT? And
Mhm.
I'll answer ETT stands for Emotional Transformation Therapy. It's a type of psychotherapy
Mhm.
that integrates verbal expression, right, talking, emotion, feeling emotion, with visual stimulation. And
Mhm.
we use light and color to help someone's brain change quickly. So how they feel emotionally and physically changes quickly as well.
Mhm.
And then they say, well, okay, so it has something to do with the eyes. Well, how is ETT different from EMDR?
Right.
Right? EMDR is one of the most popular forms of trauma treatment that we have right now. And I feel really fortunate. I am trained in EMDR
Mhm.
and I've used EMDR with my clients. And I remember when I learned how to do EMDR being so excited and thanking God that I had this kind of intervention that felt like a superpower that I could help people.
This is the solution.
Right? Yay, EMDR. However, with EMDR, there is a setup process and there are steps to preparing the client
Mhm.
um, to be able to do the process. And that is valid and good. However, for me, it slowed down the process. And sometimes people would see me and they'd say, like, I am in distress and I need to feel better now.
Right.
What can you do now? And I'd say, well, let's create a safe place and
Mhm.
let's do some assessment. And they would leave feeling frustrated. With ETT, as you know, we learn how to do it and we can immediately replicate it. We can start right away.
Yes.
And so we can do ETT with someone the first session
Mhm.
and they can walk out feeling better that very first time and know when they come back and we do more sessions, they will continue to address their pain, their wounding, emotional and physical, and continue to feel better each time that they are there. One of the other things that happen with EMDR sometimes, and I want to even say often during the process, um, I felt as a practitioner that I was more of a witness and I didn't have, I felt like the client was sometimes left kind of wide open by the
Mhm.
end of the session. I couldn't always contain them and help them to leave feeling resolved, feeling better. Ideally, a counseling session, right? It's like a bell curve. They come in, we do the treatment, we have resolution, they leave and they feel better. That would be great if we could do that every time.
Mhm.
With EMDR, that was not what was happening, and I I was questioning: is there something else I can do to have more control in helping the client feel better, like giving them more resolution so they can walk out the door and function in their life.
Mhm.
And when I learned how to do ETT and I learned what colors correspond with what emotions, what colors correspond with different body parts,
Mhm.
how do I use color and light to help people access their emotions but not be overwhelmed by them,
Yes.
right? I learned it was the right fit because now I know I am confident. I'm confident the science is going to work. That's not even a question. I know what's happening in the person's brain and how now to keep them safe, to manage how they need to feel their emotion, but not be overcome by it. They don't need to relive and re experience and tell me all of the details of whatever the distress is. We touch it, they feel, and we move on. So people will sometimes say, you might have heard this, Liz,
Mhm.
I'm so afraid to talk about this thing because if I start crying, I'll never stop.
Mhm.
Right? They're so afraid.
Mhm.
And with ETT, I can manage that with them where they touch it, but they are not drowning in the deep end of their emotions. And we can move them through it very quickly to a place of peace, calm, resolve, understanding, and clarity, where their body is different. They think of the thing differently. They feel differently about it. And so therefore, having control, having the ability to really care for my clients better with
Mhm.
ETT than I could with EMDR, that is part of what led me to really just be on fire to teach as many therapists as I can how to do this.
Yeah, I think it gives therapists so much confidence, but then it also gives our clients so much confidence because they even just after that first experience, they have the understanding that they can touch the emotion and not be overcome by it and still move on with their day and be relatively functional. And I think it mitigates the fear of therapy and the fear of specifically trauma therapy even thinking about something like prolonged exposure, right? It's evidence-based, and how terrifying to go into a therapy session knowing that you are just going to experience prolonged exposure to your trauma. And so I think that it also just really gives our clients confidence, and then they come back and they feel better, and, it's very cool to see.
I have done ETT with phobias before.
Mm,
I worked with a lady who had a snake phobia,
mm,
and it was spring, and there were snakes coming into her yard from the field on the other side of her fence. It was very distressing.
mm,
And, I also worked with somebody with a spider phobia and did ETT with that. And as you know, there are spiders all over, right? No matter where you live, there are creatures. So sh to think of her being exposed, the lady with the snake phobia, the snakes were coming in, that exposure was not making her better.
no.
It was terrifying her in one session, and it really was only one session, and we used the goggles,
Mm,
which let in light at different angles into the eyes. Her fear was gone.
wow.
I it was remarkable. I know it sounds too good to be true, but the science worked.
Mhm. After, kind of this discussion we're having about what is ETT, how we use it, um, what kind of clients it's effective for, I imagine there are gonna be a lot of therapists now who are very interested in potentially getting trained in ETT and maybe the certification process. Could you explain, the process to get certified in using ETT?
Yes. So, um, I spoke earlier about the 7 levels of training, and in level 1, the therapists will learn how to do 2 modalities using the ETT spectral chart. That was that poster with the colors that I mentioned earlier. And they will learn how to do multidimensional eye movement, which has to do with replicating one's eye movements using the sticks that have the color at the end.
Mhm.
Um, and and therefore the color is coming in the eyes at different angles while the colors correspond with the person's emotions and body experiences. And so they learn that in level 1. Then in level 2, the practitioners learn how to use we call them the goggles, and that's a device that helps light enter the eyes from different angles. And we learn how to use the light device, which is one of my favorite modalities, where electronically we can expose someone's eyes. We have a choice of 16.7 million shades of color. So we can find the shade of color that is the just right color for their brain to change how they feel. And and then the practitioner, they can call themselves an ETT practitioner as they've learned these 4 modalities. After they take level 3, where they learn the protocols, at that point, now they have knowledge of the modalities, they have experience using them, and now they've been trained specifically how to treat anxiety and depression and trauma and a list of other conditions that impact humans. And so at that point, they become certified as an ETT practitioner. When they experience level 4, now they gain an additional certification because now they've learned how to use ETT to help people somatically.
Mhm.
We ETT practitioners, unless we have a PhD or a medical degree, we are not doctors,
Right.
and we cannot claim to heal bodies, right? ETT is not going to heal a broken bone. But what ETT does is it tends to the emotions connected to the physical pain, and we treat the stress component of the physical condition.
Mhm.
And by doing that, that changes how someone feels in their bodies. And so at that point, after level 4. Now the practitioners have another level of skill, and we can certify them as an ETT somatic practitioner because now they know how to help people's bodies. After the addictions class, then they get certified as an ETT addictions practitioner because then they know the process and they know what to do and how to do it to help people who have addictions so they no longer have that compulsive need, the addictive urge to use whatever the substance is.
Right. So what's so amazing too about these certifications is that you can get to level 3 and achieve a certification, and you could stop there, although I don't think anyone does. You might have the thought to, or, I'm a certified ETT trauma therapist. I don't need to
Yes.
work on treating somatic disorders, but as soon as you finish level 3, you're definitely signing up for level 4 and then addictions and level 5, right? But in theory, there are a variety of certification options for potential ETT practitioners.
Yeah. I have another story, Liz. Do we have time for me to
Ooh,
share?
I think this is perfect. One last story.
As a sex therapist, I sometimes work with couples who experience sexual dysfunction or their relationships don't look the way they want them to. And so I worked with a couple and they graduated. So we moved through a season of sex therapy and their relationship looked the way they wanted it to. And so I let them know, the door is open to you. Once you're in, you're in. And if anything ever happens, please give me a call. You can come back. And um, the wife came back. She had been experiencing panic attacks.
Mm,
Um, she had done a few ETT sessions with me. And so she knew if something went wrong, come in, do some ETT. Sometimes it only takes one session.
right.
Sometimes it takes a series of sessions, right? It's not always one and done. Some issues take longer, and we have to approach it more than once to address that condition. But she knew panic attacks were happening. I need to go see MJ. Let's do some ETT. So um, she came in and I put her on the spectral chart. And it turns out that her father was dying
Mm,
and she had been going to take care of him. And to care for him, she crossed a bridge to get to his house. And one day, as she was crossing the bridge, she had a panic attack. Um, what ended up happening, it morphed into her having panic attacks whenever she went over any bridge.
oh,
So she was driving way out of her way to try not to go over bridges, which was not functional. She couldn't do that. And so she came in and we did the ETT. The panic attacks stopped and they have not come back. And that was a few years ago.
mhm.
Um, when she got up, and here's the part that was, it's so exciting that somebody can have panic attacks and we can do an intervention and then their brain stops having panic attacks. And
Right.
that
Amazing.
is amazing. That happened for me. I was having panic attacks, did ETT, they stopped. So I, I experienced it and I helped somebody with that. But as she stood up, Liz, when she was getting up, I saw her wince and she was in pain.
Mm,
And I asked her what was happening, and she told me that she had plantar fasciitis,
ah,
and she'd been trying all the things to deal with this pain in her foot and been to specialists and nothing was working, and that she had surgery scheduled, some weeks or a month out. And people will deal with their pain and they will minimize their pain sometimes. And so she hadn't even mentioned it because to her it was just something that she was dealing with, and she came in for panic attacks and not foot
it's not
pain.
what she was there to work on.
So I said, well, we actually have about 10 minutes left in our session. Would you like to get on the light device and let's just see if we can help your foot pain feel better? She said yes. And so She sat in front of the light device and I adjusted the colors and talked to her for a bit, asked her what she felt and how she felt about what she felt, and asked her for feedback to let me know if the pain got bigger, got smaller, moved, changed in any way. And within 10 minutes, her pain was gone and
Amazing.
zero. And when she stood up, she did a jig. She did a little dance and she hugged me and out the door she went. And to see 10 minutes, her pain was gone.
It's incredible.
It doesn't get better than that in some ways, right?
No, it doesn't, and that's why we're here talking about it, right? We're talking about it, we're trying to spread the word, getting other practitioners trained, you especially, right? Dedicating so much of your time and energy to, kind of like ETT outreach, right? To other areas and trying to connect with other therapists and get them trained so that we can help more people, right? That's why we all entered this profession in the first place, and to be able to help people so quickly and efficiently is just it's truly incredible.
I am part of the ETT research committee.
Yes.
So we have a committee that is dedicated to getting research done on ETT, replicating the procedures and having empirical data, right? So that practitioners will feel more confidence in getting trained so that, as we want to speak at different professional conferences, as we want to go to universities and teach the graduate students who are learning how to be counselors,
Mhm.
it's so important that we are able, as an ETT organization, to have data to back this up and say, here's the science, here's proof that this can be replicated, here's proof of the outcomes.
Yes.
We are working really hard to move through some studies to have the empirical data and get that published. As we do that, ETT is going to just exponentially,
Mhm.
explode. And I think that's my next challenge. Not only is it training therapists, but it is this research part that I am passionate about, of getting that done so that more people get trained and then more
Yeah.
people get helped. So I wanted
Yes.
to name, like, we're working on that diligently and really pushing there right now.
And so for anyone who is interested in getting certified or trained in ETT or doing research with ETT or even looking for an ETT practitioner of their own, I believe, MJ, all of that information can be found on the website, which is www.etttraining.com.
Yes, yes. There's information about what ETT is. There's information for um, therapists and how to get trained. There's also information for um, clients, for
Mhm.
people who are interested, and it'll explain some of what ETT is and how it works. So that site, even though it's called ETT training, it's really a place where anyone can go to get information about ETT.
Well, thanks so much, MJ. It's been great chatting with you.
Thank you for this opportunity, and it was really good to talk with you.